It's dominated our talkback and text line over the last couple of days. Certainly has this morning. The life of workers on Queensland's major government projects was revealed yesterday. Just to remind you, construction workers on these sites that are in the CFMEU, they could pull off wage increases of up to more than 50% under this controversial BPIC, while the state's teachers, nurses, the police, correction services officers, they receive single-digit increases, and they don't have anywhere near the conditions on some of these CFMEU agreements. It's a pretty lowly comparison, to be honest. To make matters worse, Stephen Miles came out yesterday vigorously defending the BPIC deals, the CFMEU tax deals. When asked about whether our frontline workers might be feeling left out, Miles said this: well, our nurses, our teachers, our AMBOs, they have among the best conditions in the country. Joining me now is Cara Thomas, the president of the Nurses Professional Association of Queensland. Thanks for your time, Cara.
Thanks for having me.
I'm keen to hear your views on this, but this morning, first of all, before we get into the chat, on 4BC Breakfast with Laura, Gary and Mark, the Prime Minister echoed the same sentiments as Mr Miles. Here's what he said.
We think people should be appropriately paid for jobs that they do, and that there should be as well important health and other conditions attached to work.
How are you feeling about this whole arrangement now that you've heard from Stephen Miles and the Prime Minister on it?
Honestly, I think they're really out of touch, and it is coming across a bit like perks for their union buddies, because we are in an absolute health crisis. We have staff off on stress leave. They're doing double shifts. They're working overtime. We've got short staffing. We've got elective lists that have blown out now to close to 500,000. You know, which elective lists are we going to have to cancel? We've got bed block. We've got, ambulance ramping, people literally dying. We've got closures of rural maternity facilities. We've got heaps on bypass. We've got a doubling of perinatal babies dying, and they're saying, oh, your conditions are great. We've had 1 in 5 nurses, it was reported, 75,000 highly professional health professionals leave since COVID. I mean, we've got staff that have just worked through a pandemic, and they're talking about getting 50% increases for, what is almost a standard commute for most people. And then when we get to work, we've got to pay for our parking, reuse your N95s during a pandemic. I mean, they're out of touch. I'm really sorry.
I expected you'd be pretty annoyed with it. I don't blame you. I don't blame you one bit. It's just BS. The one rule for one lot and one rule for the rest. It's not just... so you don't agree with Miles and Albo's sentiments that frontline workers have some of the best conditions in the country by the sound of it?
Well, maybe they should shadow some of our, nursing staff for a week while they're running a busy emergency department, while they've got ambulance ramped up, the street, doing CPR in ambulances because you've got no beds. Or how about running, a tertiary operating theatre, doing multiple emergencies, bumping, other lists, because you've got people that are waiting so long their surgeries become emergencies. You've got women giving birth on the side of the road because half of them are maternities on bypass. Our nurses are working themselves, into the ground and barely getting pay rises above inflation. With cost of living going through the roof. These are highly trained professionals. We've got degrees, postgrads to specialise. We've got masters. We are literally saving lives, and we're having to reuse masks in a pandemic because the government doesn't provide properly, and then they give 50% pay rises because you've got to work in 29 degrees. It just doesn't make sense.
Did you hear some of the others this morning that were in the paper that if you do a 2-day course and you're a traffic controller and you work on a job that's over $1 billion on a project on a state government and you're on the BPIC, the CFMEU deal, you can earn up to $200,000 a year? Now compare that to the qualifications and the responsibility that you're talking about with the nurses and people in the medical field at the moment. How do you feel about that?
Well, like was reported, the average wage for nurses is about, $84,000 a year. You've got librarians and warehouse managers and some retail workers earning more than nurses that are literally saving lives. We're coordinating emergency department and tertiary operating theatres and ICUs through a pandemic. We're not getting any more than inflation. We've got a severe shortage. People are literally dying and babies are dying. It's been doubling. It's just there needs to be an entire restructure. I mean, we are advocating and campaigning for a total restructure of the system. We need to get rid of these bloated bureaucracies. We need to get back to autonomous, locally elected hospitals with nurses in charge of local hospitals, accountable to people. And we've run the numbers. It's close to $8 billion in savings, getting restructuring and putting people back on the front lines. And we can give the nurses the pay rises they deserve and provide the services that the Australian people and Queenslanders need so that we can get these surgical wait lists under control, so that we can get emergency wait times down, so we can stop people dying in ambulances, and we can get back to a proper fetal and maternal mortality. We shouldn't be seeing what we're seeing. It's ridiculous.
So how do you feel when you see cost blowouts on CFMEU projects, on transport projects like the one I mentioned earlier, that to the Gold Coast Rail, 13 Ks of track, it's gone from 2.7 billion. Now they're saying it could be up to 7.6 billion. So largely because of the CFMEU tax adding time, adding costs to the job and blowing the time frame out on the job, that money could go towards what you just spoke about.
Exactly. I mean, it does feel like it's deals for the boys, for their union mates, for political power games, when we should be investing that kind of money back into our health system.
Are they tone deaf, the leaders, and do they listen? Like, are any of the other unions now going to go, all right, let's go cap in hand, and let's go and, well, not cap in hand, let's go and have a meeting and let's put it on the table and go, hey, well, if you're doing it for them, what about us?
Yeah, well, it shouldn't even be just it's like you guys are working hard. Look at our system. I mean, seriously, review where the money is going and invest it properly so that we get proper outcomes. This isn't about just giving money to ensure, you've got money from your buddies so that you can, put it into advertising, into an election campaign or whatever is happening exactly. This is about the people. You are elected representatives that are supposed to serve your people and get the best outcomes. Our health system is in crisis and only getting worse, and it appears that they're giving kickbacks to union mates rather than providing the very best health services available and giving nurses and teachers the pay rises that they deserve.
So if your union was to go and say, hey, look, what do we need to do here? Do we need to kick some money into the can? Is that the only way you think you'll get a fair hearing? Is that what seems to be happening here?
Well, we don't give any money to political parties. It's in our constitutions. We will fight, politically for the best interests of our members and for the health and safety of our community, but it shouldn't be. I mean, if what you're suggesting is that, you've got to give kickbacks and brown paper bags to try and get appropriate, that's horrible. This is about providing services. Politics shouldn't be about playing games. It should be about providing the very best for your people, and that's what we're fighting for our members and for the health and safety of our community.
What are you getting any feedback from your members, what they're actually feeling about reading all this stuff and learning about all these perks that are available to this particular section of the union movement and working on government jobs?
Well, we get a lot of feedback from our members about how burnt out they are, how some are on stress leave, how short-staffed, how the skill mixes aren't right, how they're having to cancel lists because of staffing problems. So, and we've had lots of positive feedback about what we're fighting for. So, absolutely, there's huge safety concerns of staff. We've got to outlay every time, they're getting $1,000 because they go more than 50 Ks. That's a standard commute. And then literally we have to pay for our parking when we get there, and we can't even get staff parking close to the hospitals oftentimes after hours, and you have to walk in the dark after an afternoon shift or coming onto a night duty up dark alleys to get to work because there isn't even staff car parking. So there are lots of issues and lots of things that we're fighting for on behalf of our members. Where
do you go to from here then? Is it to the point where you want to request a meeting, or do you need to talk with the Minister, Shannon Fentiman? Where do you go from here off the back of all of this to voice your concerns and ask for a better deal and an ear just to be able to be heard?
Yeah, well, obviously I'm doing quite a bit of media. We are running campaigns. We write to the Minister on behalf of our members. We survey our members to find out the key issues. And yes, we will be continuing to fight hard for a restructure of the system and for proper pay and conditions, and to ensure we can deliver both for our members, appropriate pay rises and conditions for our members, and then better health conditions for the people of Queensland.
Would we ever see, and I know they wouldn't do it because all the nurses, ambos and police and fireys, all the frontline workers do a wonderful job, and they always put the people they're treating and working with first. But is this ever going to lead to industrial action where it gets to a desperate stage like that, where you have to do that to go, oh, well, if you're not going to come to the table and listen to reason, there's going to be industrial action?
Well, we'll do whatever is necessary to fight on behalf of our members, and that is within the law. So, yes, we will keep fighting on behalf of our members and on behalf of the people of Queensland, because we all deserve better than this.
Could we ever see walk off the job strike action like I'm sure that some of these CFMEU people would do if things weren't happening on their work sites?
Well, I mean, you can take action, but there's only certain actions that you can take, because you can walk off a construction site and, nobody dies. But you walk out of a hospital and people die.
Yeah.
People rely on us. So there are actions that we can definitely take, but it'll always be with the health and safety of our patients in mind.
As expected. Brilliant to talk with you. Thanks for your time.
Thanks so much.
Cara Thomas, the President of the Nurses Professional Association of Queensland.